Allison.
Hi, Michael.
And welcome everyone to Dean's Discuss COVID-19. This is our weekly podcast in which we dive into the research and what's going on here at UC Davis with both the College of the School of Medicine as well as the School of Veterinary Medicine.
Yes, there's lots to talk about how COVID-19 has affected our research, our medical communities, Zoom meetings, PPE, social distancing, and physician and healthcare burnout, and what we're doing to combat it.
This should be good because all of us are seeing the effects across the spectrum of all of our frontline healthcare workers to our students. And, everybody in our society and around the world knows that this pandemic has affected all of our lives and it's affected all of our programs. And so we might want to delve into a little bit about our universities, our research programs, our clinics. How did it really change? Thinking about what were we doing in January, and then how did that change once March came, and then some of the things we're seeing today. So I'm going to let you start out, Allison, because you were and your teams were on the very first case, I understand, in Northern California.
That's right. It was the very first case. It was on February 26th that we were notified that we had the first community-acquired case in the country. That just lit up the ideas about all that we needed to do. And so we marshaled many people together and turned around trials in 5 days and developed a test and had to work through PPE and masking. Students were taken out of rotations, and then nationally things just exploded. So I think that it's been something that we haven't really appreciated the effect. So the effect on all of our lives. So just yesterday, Governor Newsom said everybody who is out in a meeting, whether it's indoors, outdoors, needs to wear a mask. You and I should have masks on. I know you have a wonderful one there.
I brought one, so
yes.
Here we go. So it's a good way to advertise your business as well. So Allison, I have one that has, I think your dog is represented here someplace, right?
Yes, my Beagle and my Border Collie there represented. So, I love that mask. I think I've just got paper. So first of all, our frontline workers, I just can't thank them enough. The people in the emergency room who were the first to deal with this, and then the nurses and the doctors and the residents and everybody, it really impacted every single person in the hospital and really every single person in all of our communities who care for people. I can remember, they put all the patients in one unit so that they could try to keep that unit and figure out how to take care of people. And so now we've actually kind of come out the other side, although we're seeing a little bit of a blip, but people are pretty tired. And everything is still changed. So we all do meetings with Zoom. We have masks. We're monitoring our ability to do testing. So I think we're going to need to be very mindful about burnout. I know that Dr. Helen Kales, our chair of psychiatry, has been really wonderful. Mm-hmm. She's worked with the chairs and departments and hospitals on ways to deal with anxiety. It's kind of scary to come to a work where there's a virus.
It really is. And as you were describing that first patient, as it, that community spread, it sent ripple effects throughout the entire university, as it did the entire region and, of course, the country. One of the interesting things about that is what we tried to do is to respond in a positive way. One of the immediate things was supplies, of course. And so what I was really, happy to see is the community come forth with providing supplies. So we donated, for example, extra masks and PPE equipment. We inventoried all the ventilators, expecting the very worst. And, so that was a very
and the
positive.
magnet? Did we give your dog and the cat ventilators back?
Yeah, yeah. Well, I think so. Yeah, yeah. Uh, and that was really refreshing to see that
It was
that was
incredible.
positive. And then the dedication, as you mentioned, of all the frontline healthcare workers. And you know, the other thing that was rippling was we were still in class, and all of the curriculum, not only on campus but within our schools. So our students had to finish up. We talked about that on an earlier episode of how we had to change everything. That brought on, of course, a lot of extra work for our faculty, our students, everything from testing to, you know, how do they do their classes online. But what was really a side effect of that is the added stress, as you mentioned, because you could feel the stress among the faculty, you could feel the stress because they had to ramp up very quickly. They had to take a course that they would normally deliver in a lecture and then switch that to online. And so we relied upon a lot of technology to capture the lectures. Fortunately, we had a lot of systems in place to do that and then allowed those to be relatively smoothly transitioned. What was more difficult, of course, was any lab work, any
Yeah.
clinical work, and you know that stress you could tell was getting to people. And then, as you mentioned, our life on Zoom, which just seems like I don't know how many hours you were spending today, but at least half of our day seems like we're talking to a camera on Zoom, and that's just not normal human interactions. And
Well,
so what's going on there?
you
You
know,
mentioned the
I don't.
psychological effects.
I'm a neurologist, so I am not sure, but I do think it takes a lot more work to do Zoom to pay attention. I think it really probably uses different parts of your brain. And the other thing is, you don't get that interpersonal relationship, right? There's no more handshaking, no more
Yeah.
hugging, everybody's standing far apart. And of course, that's what we want. But part of being in an academic health system is those relationships, right? So I
Hmm.
think those are really key. You know, I think this is kind of a new normal. For a while, I think we thought, oh, this will pass. But boy, you go home at night and you turn on the news and you realize other states are hot. California is heating back up. It's not going to pass. And so we're going to have to think about all of those new ways. Now, the good thing is telemedicine, for example, I don't think we'll ever go back. Lots of things can be done with telemedicine, huge research in telemedicine, seeing research patients. And for you, I can imagine there's probably some telemedicine. I could hold up my little beagle and you could look at her and
Exactly.
see
Yeah.
what she's up to.
You're,
But
yeah.
I do think I worry about the pace of things. Um, you mentioned the lectures. You mentioned it used to be the pace was a little bit slower, and now you've got the intensity of taking care of these very sick patients in a disease we know very little about, who get sick very quickly. And then you have all of these changes with PPE and masks and temperature taking and Zoom and all of that. I think as leaders, we're going to need to figure out how to recognize people, how to rebuild communities when you don't have a community of people being side by side. It's
Yeah.
uh, it's really a little daunting to think about
Yeah,
sometimes.
I know both of our campuses, you know, we had mental health and wellness
Yes.
for our students and our staff and our faculty, and we've invested a lot in that over the last number of years because we know that our medical students, our veterinary students are under a lot of stress anyway. So we had developed a lot of that, but we were not expecting a pandemic to change our lives as rapidly. So we're seeing things, for example, disruptions of sleep patterns, you know, because we are on Zoom a lot, or that chronic stress, it catches up with you. One of the things we talk about a lot is taking breaks, having our students turn the TV off for a while, or
Yeah.
turn the social media off for a while. And I see a lot of resources now that are specifically being targeted. It's not like these problems weren't there, but a pandemic really brings them out in a more visible fashion. So, for example, if you were suffering from mild depression and now you're socially isolated, on top of that, those exacerbate those pre-existing conditions even further. So I think you're correct. I think one thing that we have to do as leaders, in addition to developing those resources, for support for our students and our faculty and our frontline healthcare workers, but also think about new ways that we can help them so that they can seek help faster or be identified more quickly, because we do know that this is going to add to that stress, that sleep loss, that another big stress, which I know you're facing with your faculty, I know I'm facing with my faculty, is families.
Yes.
Families that have
Childcare.
children at home.
Yeah.
Yeah. Do you have that problem? And what are some things that you're trying to think about related to
So early on, we worked on providing childcare, but the problem really wasn't childcare because no one wanted to take their children to daycare, even if you had it because of the virus. So I think it's really part of the solution is telecommuting for people who don't have to be here. If you're working on a computer all day and doing billing or things, could you do that at home?
that? Mhm.
You could also then think about flexible work hours for people because if you think about it, the schools aren't open, the daycares are just now reopening. Everybody's very concerned. Now we have children getting this autoimmune disease from the virus. So I think, it's really a very stressful time to be a parent. I have college age children that came home from the East Coast.
Mhm.
And I know that's stressful because you worry about them. I can't imagine having little kids and working and being a nurse or a doctor or resident working in a hospital.
Mhm.
And you hear stories about the folks who work in the emergency room, the front line. And our chair of emergency medicine, Nate Cooperman, has been very proactive about making sure that people don't get complacent, because if things tick up, the first place they're going to be coming when they're really sick is in the emergency room. And we want to make sure that it's safe for our employees as well as safe for our patients. So,
Yeah.
I just think it's a new normal, and it's going to be a while.
One of the groups that are especially affected and disproportionately affected is those that are on the front lines, but also don't have the means. So, we know the social injustice of COVID has disproportionately affected, African Americans, others that are, not have the ability, perhaps, if their jobs, they have to go to work, but then they may not have health care. And so they're caught in a bind, so it's doubly affected. So our society, those that don't have the luxury of having health insurance unless it's tied to work, the higher unemployment, the number of people that are off unemployment, that's going to add an additional layer of stress. So we know this is coming. We can anticipate mental health and other issues, domestic violence, from people that are at home and they can't escape their abusers. These are things that we're starting to see, which were predictable once we went into that lockdown phase. And so one of the things as leaders I know that you're very conscious of, and we really think about, is what are all the resources that we can bring to bear to help our populations, that we're responsible for within a university. So we've been accumulating those. I know you have as well. Resources, I know the university has. So on our website, for example, there are resources that range from CDC resources to how to handle racial tension in our days in which we're having social disruptions. These are all things that we need to help. We need to talk about it. We need to make it available, and we're trying to find resources to help fund it as well. I know that's important at the medical school as
Oh,
well.
absolutely. And we're really reaching out to our communities, particularly our communities around us, and in terms of just some things like testing and nursing homes, making sure that people get the health care they need. We have patients who have deferred care, which is terrible if you have hypertension, heart disease, diabetes, cancer, you know, when you don't go to the doctor because suddenly you're worried about your copay, or you lost your insurance, or you can't get there, or you're afraid, you're gonna not be as healthy as you could be. And so it's not just COVID, it's the impact on our entire community. And so I think as leaders, it's just the tip of the iceberg. It was interesting today that now the NIH is actually funding a couple initiatives on kind of social determinants of health.
Mm-hmm.
And I think those are incredibly important because I think that the impact of this is going to be with us for a long time. I know you trained in the time of HIV, and that was some of your initial work. I did my medical school and residency in neurology during that time. And, it just took years and years, basically our entire career, for the world to get a handle on that and come up with treatments and things and be in the good place that we are now, things that students would never believe if we told them stories. And I think that that's going to be the way it is with COVID. We have a new class of medical students. They start in a couple of weeks, and they are 128 new medical students. And it's a scary time to start medical school. It's an exciting time to start medical school. And there's so much to learn. It's kind of like building the airplane while you're flying it, right?
It really is, yeah.
But their lives are going to be really changed forever.
Yeah, it reminds me of, having gone through 9/11 and how our life
Yes.
changed after that. It feels like that. One of the things that we've seen also is an appreciation of the human-animal bond. People when they were home in isolation, their pets became very much a comfort to them, and we've seen a lot of interesting effects of that socially. For example, there was an increase adoption rate of shelters,
Yes.
and that was wonderful to see. That was an effect upon people that needed that extra unconditional love that humans need from animals and their pets, and they derived it. Now, in the case of my cats, they're wondering why I didn't go back to work. So I disrupted their sleep patterns in a different way. So instead of sleeping 18 hours a day, they only sleep 16 hours a day now. But I think that you are absolutely correct. The other thing that you mentioned was, this is not going to go away tomorrow. It isn't the new normal. And we did have to adjust, and we have adjusted, but we will expect more disruption. One of the things I tell our students is that, one of the things that these opportunities bring up is the opportunity to express resilience. And our students are amazingly resilient. Our faculty and our staff have been resilient from the frontline healthcare workers all the way through to those that teach. And that resilience has carried us through this. And I've been very impressed with how the university has responded, how all of our people have responded. But it's not going to be a simple, it'll be done by the end of the summer. We may face this as a continuum.
Yes. And Michael, this has been just such a great discussion. I have a question for you. Do you think we're prepared for the second wave of this virus?
That's a great question, Allison. We'll look at this next week because it isn't going to go away anytime soon, as we discussed. So please join us for a robust discussion on the second wave of COVID-19, and what we're going to be doing to get ready for it.
And I'm Allison Brashear, the Dean of the UC Davis School of Medicine.
And I'm Michael Larimore, Dean of the School of Veterinary Medicine. And you've been listening to Deans Discuss COVID-19 podcast. Be sure to subscribe so you won't miss an episode.
And we welcome your questions, your ideas on topics for future episodes. You can email us at deansdiscuss@ucdavis.edu. And in the meantime, you can visit ucdavis.edu/COVID-19 for the latest coronavirus. And we'll see you next week.